Hello, good morning. I would like to start by acknowledging and paying respect to the people of the Kulin Nations, the traditional owners of the country on which we are gathered today. Welcome to Signs for Health. Thank you for coming today, and thank you. Someone taught me that, so just so you know. Signs for Health is an important new web-based resource to support hospital staff and patients who are deaf, hearing impaired, or hard of hearing. This event is being held today by the Victorian Equal Opportunity and Human Rights Commission in this National Week for Deaf People. The Commission undertook a review of how Auslan interpreters are provided to patients in Victorian hospitals by consulting with staff in a selection of health services and provided recommendations. A reference group was established to respond to those recommendations, including representatives of the Department of Health and Human Services, Deaf Victoria, Vicdeaf, the Women's, and Bendigo Health. The resource being launched today is part of the response to the Commissioner's recommendations. We are very pleased to support the resource being presented to you today. The Women's is happy to host this event and to join you all in a shared commitment to ensuring patients who are deaf or hard of hearing receive equal, safe, and high-quality health care. Without further ado, I would like to introduce the MC for today, Kristen Hilton, the Victorian Equal Opportunity and Human Rights Commissioner. Welcome, Kristen, and thank you, everyone.
Well, hello and welcome everybody. Thank you for coming. My name is Kristen Hilton. Oh, sorry, I've got that wrong. And I'm getting some applause. That's very nice. I know some sign, but I'm still practicing. And thank you to the interpreters, and thank you to all people who are signing today. It's fantastic to be here at Signs for Health, and it's a fantastic resource that we're launching today. I'd like to begin by acknowledging the traditional owners of the land on which we meet, people of the Kulin Nations, and pay my respects to any elders past or present. I'd like to acknowledge our special guests here today, Sue Matthews, CEO of the Royal Women's Hospital, for hosting the event and for their fantastic participation in the project. I'd like to acknowledge and welcome Mary Ann Thomas, Parliamentary Secretary for Health and Parliamentary Secretary for Carers, and Brent Phillips, General Manager for Community and Language Services at Vicdeaf. And I can certainly say without Brent's enthusiasm and support and assistance, we wouldn't have the launch here today. So thank you very much, Brent. Brent told me before that he used to work at the Commission about 10 years ago. So it's always lovely to know that our circle is ever increasing and the influence continues, whether or not people are actually at the Commission or out there in the community, promoting equal access and promoting rights and respect for human rights. So today we're launching a fantastic new resource, Signs for Health, and that's the hashtag if you're on Twitter, and we hope it will help deaf, hard of hearing and deaf-blind patients to better access the healthcare that they need and that they have a right to under our law. I'd particularly like to thank the members of the project reference group, Brent Phillips from Vicdeaf, Melissa Coe and Jen Blythe from Deaf Victoria, Kim Gratius from DHHS, Connie Pacelli from the Royal Women's Hospital, Kim Muller, oh sorry, I'll slow down. Connie Connie Pacelli from Royal Women's Hospital, Kim Muller from Bendigo Health, and I'd also like to thank Julian Albin, Bridie Hudson from the Victorian Equal Opportunity and Human Rights Commission, who have so ably and enthusiastically led this piece of work. I'd also like to thank a former Verioc employee, Lauren Days, who also worked on the project. Safe, high quality healthcare is essential to all people in Victoria. All hospital patients have the right to be informed about the services and about the treatment options that are available to them. We know that Auslan is the first language for nearly 3,000 people in Victoria and many more Victorians who are hard of hearing. So communicating with patients who are deaf, hard of hearing or deaf-blind may require Auslan interpreters or other communication adjustments. And failing to provide Auslan interpreters and other communication support, importantly, may be against the law under the Victorian Equal Opportunity Act. Public hospitals also have obligations under the Charter of Human Rights and Responsibilities, and I think it's fantastic that this hospital is taking those obligations so seriously and is a leader in that respect. We undertook this work because we heard the stories of people who have not received the communication adjustments that they require in some instances from hospitals. It's not just the fact that it's potentially a breach under the Equal Opportunity Act. What really compels us to action is those stories that we hear from people in the community. We heard this from our own stakeholders, including the members of the Disability Reference Group that we run at the Equal Opportunity Commission. And I'd like to acknowledge former Disability Reference Group member Peter Adams in particular, who's also here with us today, and from Deaf Victoria's report on this really important issue. The Deaf Victoria inquiry into access to Auslan interpreters in hospitals was a major piece of work, and I also congratulate Melissa Coe, who's here today, and her colleagues from Deaf Victoria. This report highlighted many positive examples of people having access to communication adjustments, but it also told us stories of people who just didn't get the treatment that they needed. And I'm not talking about medical treatment, I'm talking about the communication methods that they did or didn't receive when they were a patient. We heard about a man who'd woken up from emergency surgery and didn't know the treatment that he'd undergone. We heard about a woman who was kept under anaesthesia for longer than necessary while people tried to locate an interpreter for her. We heard about a man who was in hospital for 6 days and who repeatedly requested an interpreter and in fact watched an ad from his hospital bed on his hospital TV in his room telling him to ask for an interpreter, on which he did on many occasions, but to no avail, and in fact left hospital without having received the communication that he needed. I think every person in this room would agree with that. We need to better educate people on their rights, and we need to better educate duty holders about how they need to comply with people's rights. And this is what Signs for Health aims to do. It's an easy-to-use online resource with information in Auslan and written materials to help people access healthcare. I once again commend the efforts of the staff at this hospital to address this issue, and all the people in this room, many of whom have had something to do with this project in some way, and for making an ongoing commitment to ensure that people receive the assistance that they need, that people have an understanding and a true ability to access their human rights. The website is signsforhealth.com.au. I encourage you all to go online and have a look, learn some Auslan. My experience is it's like trying to speak a different language. People will commend you on your effort, even if you get it completely wrong. I'd now like to hand over to the Parliamentary Secretary for Health and the Parliamentary Secretary for Carers, Mary Ann Thomas, to officially launch Signs for Health. Thank you.
thank you to everyone coming together today on this really important occasion. I'm afraid to say that my Auslan is as poor as my French and my Japanese. At this point, I did want to commend all of our interpreters who are here today for their amazing work that often goes unnoticed and unacknowledged. But I commend you on your work in ensuring that members of our deaf community can participate today in this really important launch. I would also like to acknowledge the traditional owners of the land on which we meet and pay my respects to their elders past and present. To the CEO of the Women's Hospital, Sue, thank you so much for hosting this really important event. To Kristen, the Commissioner, Victorian Equal Opportunity Human Rights Commission, thank you for all of the work that you have done, and it's great to meet with you today. To Brent Phillips, the General Manager of Community and Language at Vicdeaf, welcome to you and thank you for all of your work. The Victorian Government believes that everybody in our state, regardless of their abilities, their gender, their sexual orientation, or their income level, deserves access at all times to the highest quality health care. Here in Victoria, we are lucky to have some brilliant world-class health facilities. But unless we work to make certain that those facilities are accessible to all Victorians, then we will not be able to realise that aspiration of everyone being able to access equally our health facilities. And at this point, I do need to note that access to our health facilities has not always been as it should be for members of our deaf community. And I think that that was highlighted to us by the stories that Kristen just told us about. The 2015 review by the Victorian Equal Opportunity and Human Rights Commission absolutely highlighted the need for improved awareness and training for hospital staff about their obligations to provide Auslan interpreters. And for me, it's been terrific to learn that Auslan is the first language of more than 3,000 Victorian people. I know that the Commission has been working closely with stakeholders, including the Health Department, Vicdeaf, Deaf Victoria, hospital representatives, the Australian Sign Language Interpreters Association of Victoria, and the Disability Discrimination Legal Service to come up with a solution to these issues. So I'm really delighted to be here to join with members of our deaf community and the Commission to officially launch Signs for Health. What a tremendous achievement this is. The website and its associated resources provide a way for hospital staff and patients to learn more about their rights and their responsibilities regarding the provision of Auslan interpreters in Victorian hospitals. As Kristen also alluded to, we absolutely know that health outcomes are dramatically improved when there is clear communication between a patient and their healthcare providers, and that includes staff at all levels in any hospital. Good communication builds trust between clinicians and patients and reduces medical mishaps and confusion for patients and clinicians alike. We also know that there is clear evidence that good communication will help reduce the rate of unnecessary or readmission to hospital, preventable readmission to hospital. So this is not just a resource that benefits individuals and including patients and hospital staff, but it is a resource that will ensure that our health system operates more efficiently and seamlessly in order to ensure more Victorians can access the world-class health services that we have here in Victoria when they need. The Signs for Health resource is part of a range of measures in hospitals across Victoria, including the Cultural Responsiveness Framework and the Language Services Policy. These resources are about ensuring, as I said at the very beginning, that our world-class health facilities are accessible to all Victorians, and especially today noting the need to ensure our facilities are accessible to people whose first language is Auslan. So can I thank you once again for coming here this morning. It's a real pleasure for me to be here with you to officially launch Signs for Health. Thank you very much.
And I do want to take the opportunity to commend the Victorian State Government on their commitment to equality. We see that through their commitment to gender equality, through having the first Minister for Equality, the first Commissioner for people with first Commissioner for LGBTI, and through their strengthening of the Charter of Human Rights. This project is about turning those laws on the statute book into something real and something accessible for people in our community. And one of the people who has worked very hard and on a daily basis in his organisation to advocate for those members of the community is Brent Phillips, General Manager of Vicdeaf. His contribution to the project has been invaluable, and I'd like to welcome him to come up and talk to you a little bit about his participation in the project and what it means for him and members of the deaf community. Thanks very much, Brent.
Thank you, Kristen, for your introduction. It's absolutely great to be here, and a culmination of years of hard work, and it's quite unbelievable to see that we are actually launching this wonderful resource. I'd like to acknowledge Sue Matthews, the CEO of the Royal Women's Hospital, Mary Ann Thomas, the Parliamentary Secretary. Deaf Victoria, we have Jen Blythe, the Advocacy Manager, and Melissa Coe, the previous manager, who unfortunately can't be here with us this morning. Peter Adams, a previous member of the Commission and their disability group, so thank you so much for your work. And I'd like to acknowledge my boss, Chris Matheson, the CEO of the Vicdeaf. I'd also like to acknowledge the traditional owners of the land that we meet upon, the past and present elders. As well, I'd like to acknowledge the leaders of the deaf community and the interpreting industry who have advocated for access and for equality and inclusion over the years. I know those people, some of them may not be here with us today, but they will be very proud of this particular project and the philosophies of this website. It's an honour to have been asked to be a part of this launch. I'm one of a team of people who have been involved in this project, worked quite closely with Deaf Victoria and the people from that organisation, and they ultimately started this project. I feel as though I've just been quite fortunate to be a participant on this journey, and I'd like to acknowledge in particular Melissa Coe and her commitment to this project, where she originally identified the real issues in the community and interviewed 75 to 80 people of the community and gathered their experiences, both positive and negative, accessing the public health system. This report was presented to the Commission, and I acknowledge the Commission for their commitment to take up this project, and we are here thanks to that commitment. I think the timing of this launch is quite perfect. We're in the middle of National Week of Deaf People. This whole week there are a variety of activities and events occurring, and we've just had the National Auslan Conference over the last weekend. We had 300 people attending nationally, both deaf community members and interpreters, talking about a variety of topics such as the National Disability Insurance Scheme, interpreter equality, access to society. And this week there's been plenty of events happening throughout the community, and this Saturday we're having the Deaf Expo, which really is a perfect time this week for us to launch this particular website, where we are celebrating our culture and our language. As I mentioned before, I would like to thank the Commission and Kate Jenkins in particular, the previous Commissioner, and Kristen, the new Commissioner, and the team at the Commission, Julian, Ian, Bridie, Megan, and many others that I'm not mentioning at the moment, but thank you for your commitment to this project. And we can see you have a genuine interest and a genuine desire to see the deaf community have access to health services in Victoria. And it's been a great team I've worked with, and we hope this isn't the last opportunity. And there'll be other projects where we can work together with Vicdeaf, Deaf Victoria, and the Commission in the future. I've had my own personal experience as a patient in a hospital. 3 or 4 years ago, I went to a public hospital provider and I was there for a week. During that time, I never had access to an interpreter. I wasn't in the right frame of mind to advocate for myself, and many people, when they're in hospitals, are in a similar, perhaps physical or mental capacity or unable to make those decisions. And I had doctors communicating with me, and I never actually had access to an interpreter. I got out of my bed and I looked at the file at the end of my bed, and it actually noted on there, well, it says, does the patient need an interpreter? Yes or no? And someone had actually ticked no on my behalf. So someone had actually decided on my behalf I did not need access to an interpreter when I was in hospital. I couldn't believe that decision had been made. And I hope this project and this resource will go some way to increasing the awareness in hospitals that there's a need to provide access. It doesn't matter if the person says yes or no, but you cannot make that assumption on behalf of another individual. I think the onus will definitely be on hospital providers to make sure your staff are aware of this project and the resource. And it's built into your training. I know hospitals have high turnover, but hopefully strategies will be developed where new staff and current staff know about this resource and can have time to learn a little bit about the communication needs of deaf, hard of hearing and deaf-blind people, the booking process for interpreters. And I do understand the responsibility is also on us as an organisation in the deaf community to increase awareness in the community about this resource. So when deaf people do go to hospitals, they feel empowered to communicate what their rights are, and also encourage the practitioners to look at this resource. So we do need to work together to increase the awareness both in hospitals and within the community. Vicdeaf has been around for 132 years, and we've provided a range of supports to our community here in Victoria. Employment services, audiology services, independent living skills, and interpreting. Alzheimer's Connections is Vicdeaf's not-for-profit interpreting agency. We are fortunate enough to be on the HPV Language Services Procurement Panel in our own right as a language service provider of Alzheimer's interpreters. It's great to see some language services managers here from hospitals. We've developed great relationships with many of you here today, and it's exciting to see you here and showing your commitment to this resource and the deaf community. That's one thing I'm very proud of with Alzheimer's Connections, our commitment to provide the best possible match between client and interpreter, our in-depth knowledge of the interpreting industry and their skills, and the deaf community and their language register and language needs. And that puts us in a very unique position to provide a seamless service. As well, our commitment to reinvesting any surplus funds into our community and strengthening the deaf community, as well as upskilling our workforce of around 200 interpreters here in Victoria. A recent example, we provided a statewide live streaming PD session about medical interpreting. And we're committed to upskilling our workforce. It's one thing to have this fantastic resource and this project, but we need to make sure the quality of our interpreters increases as well. We received funding from the Department of Health and Human Services to provide a video remote interpreting service, which is critical for regional and remote hospitals where there's no local interpreters to provide that service. So it's great that we're able to use technology to provide that support to patients in those locations. And that's one example of Vicdeaf's strength and the partnerships that we have with the Victorian government. A few weeks ago, we received information from OMAC, the Office of Multicultural Affairs, that they will be providing $30,000 worth of funds to Vicdeaf and RMIT to deliver a course dedicated to deaf interpreters. We're seeing many deaf people moving into our community from migrant backgrounds, and their language needs are quite diverse. Deaf interpreters play a vital role in being able to provide access to this cohort within our community, and it's great the government have recognised this need and will be able to provide interpreting to grow that sector of our workforce. It's great to have Marianne here and you being able to reflect your commitment to this project, so thank you very much. In terms of Auslan and the language of the community, Vicdeaf will be having our 132nd AGM this evening. We'll be having Alistair McEwen, the Federal Disability Discrimination Commissioner, being our guest speaker. I think the profile of Auslan really has never been as high as it is, because of people such as Al, who exposes the language and provides that platform and promotion for our community, as well as Drazana Levitsky-Gray, who is the 2015 Young Australian of the Year. The spotlight is on our beautiful language, Auslan, at this current time, and that's something Vicdeaf's very, very proud of, and this project will only enhance the reputation and profile of our language. In conclusion, I would again like to commend the Commission and your commitment to develop this project. You saw the importance and you saw the gap and you actually addressed it, so well done. I look forward to working with the Commission and Deaf Victoria to make sure this resource is sustainable. So thank you to the hospitals that are here today as well for your commitment and support, and we look forward to working with you as well to increase the awareness in hospitals about this resource. Thank you to the deaf people that are here as well, and the people that unfortunately suffered previously, and may they never be put in that situation again. Thank you very much.
Thank you so much, Brent. You're absolutely right in that we have the resource now, and it's a commitment I think that everyone in this room needs to take up to make the resource real and to make sure that it is available to the people who need it. I find your language very beautiful. I could really see it all day, and I'm glad that this resource not only provides access to the communication that people need, but it is also another way to help that language thrive and receive the recognition that it deserves. Thank you all very much for coming. I think it's been a fantastic launch and a really important part of the Commission's contribution to Deaf Awareness Week. Good luck to Vicdeaf for your AGM. I think it's wonderful that you've got Alistair McEwen there, who, as Brent said, is a fantastic advocate for the rights of people with disabilities and for the deaf community throughout Australia. Have a fantastic day. Thank you for coming, and let's continue to communicate.